Well, thank you, Mary Ellen.
You're
Hey,
welcome.
Margie. Margie, welcome back to Booster Shots, to Bouncing Back, Section 11.
Session 11.
I know.
Can't
So
believe
thanks
it.
for joining. Yeah, we're almost through it.
Hey, everybody. Thank you. Thanks for having us. Thanks for coming back. We know coming off of, for some folks, a holiday, perhaps yesterday. We didn't get to, but we were here. But we are so delighted to have you. And today's got a great subject. And I need you to think about it and kind of put yourself in a bit of a perspective where it's kind of, we talk about mission and vision statements, and it sounds like big organizational thing. But if yours doesn't work, or if you can't even tell us what it is, which we'll ask you in a couple of minutes, one of the things to think about is, how you can actually take it on your Flora unit and use it as a guiding principle right there. Just, you don't wait for leaders to jump in. Sometimes just do it on your Flora unit. So keep wherever you are in this story, and I do hope you do jump in, because we so would love to hear about some of the things that you're doing in your place and how this kind of resonates for you. Thank you to everybody who's been jumping in on chat. So please be sure to do that. If you feel like you can turn a camera on. I guess you know by chapter 11 that we are IPRO, the QIN-QIO, that's made up of 3 different organizations: IPRO, Health Centric Advisors, and Clarent, all of us working together across all those blue states. So not politically blue, just the color we're using on this particular slide. We're here all free. You just call us and we help. What could be better? We always like to start Booster Blitz. Booster Blitz was kind of like our brand for this series. This is we're moving along, and as Melanie mentioned, we're on number 11, and so we're just about to finish up. But we always like to bring in this part because we like to think that we're making some progress. And to that end, you'll notice here that you can see that there's little steady progress being made all along the way. And I gotta say, it's all of you. It's thinking of new messages, helping staff to kind of and get the mission of why it's so important to get boosted. It links meaning and purpose to people's jobs when you yourself are kind of like the first line of defense and willing to get a booster shot. That's what the meaning and purpose part, that's where it all comes in. So we're grateful to all of you who are working really hard with staff to kind of keep that whole thing going. I know it's like pushing a mountain up the hill when you're at the, what shall we say, like when you're at that really difficult 87%. And you feel like every single day you're out there saying the same kinds of things. But Melanie and I have, having done our previous series of Booster Blitz, we always think of it as the slow yes. So maybe you can put it on a timeline and eventually consider that folks will be with you. So today we're over here on meaning and purpose, and how daily work is connected to what people are called to. Believe it or not, we've actually run through almost every single one of these now. So we've almost completed the pinwheel. I don't know what you've picked up along the way. Maybe at some point, if you're thinking about it, if there's something that has piqued your curiosity or you even implemented in your organization, we'd love to know what that is. Today's meaning and purpose, it really looks at how daily work is connected to what called individuals in the first place, or I think we can even put something like vocation on it. And when we stop and think about it, if you ask anybody in a nursing home, like why they got into it, I don't know, let me check. Melanie, why'd you do it?
It was my calling. it can, I was meant to be a nurse my entire life. That was who I am.
Yep. Mary Ellen?
I would say the same thing. It was my calling. And as if you were on at the beginning, music is a calling too, but nursing called me strongerlier. It just did. I think that sense of service to others.
Yeah. I wanted to make a difference, and come to find out, it wasn't a better place for me. So I feel like I did. What called people, or that vocational kind of thing, they actually did a study years ago, and they actually asked that question, and almost without fail, people said they wanted to make a difference in people's lives. And that was huge. So right now, because of the chaos and the disruption created by COVID, short staffing, lots of things have kind of generated that sense of disruption. And so what we're trying to do is kind of, as we think about rebounding and trying to kind of come back, I know some of you have COVID in the building, so I'm not dismissing where we are, but right now, daily work is connected to what calls individuals, that vocation, and the line of sight to the organizational's goals and principles. I'll show you a couple in a minute. And then consistency of purpose. So like what's happening through that mission and vision, through that's where the meaning and purpose is coming. People's intrinsic motivation, people show up locked and loaded, want to do a great job, want to make a difference. And so there should be a straight line between that. And the way you create that line a lot of times is with leaders who talk about it a lot. So if you don't know your mission or vision statement, for instance, it might be that you're not hearing it. You're not connected to it, which is why you might need to take a first step, which might mean just doing it on your floor or unit. It's been told 1,000 times, I'm sure you've heard it, but back in the day, 1963, President Kennedy was busy. He was visiting NASA, and he had a big entourage with him. And along the way, he meets up with a janitor and says, "Hello, I'm Jack Kennedy." And the guy says, "Yeah, I know." And he says, "Oh, what are you doing?" And the guy says, "I'm helping get a man to the moon." He was sweeping the floor. And that ultimately is how embedded the whole notion of the meaning and purpose and the mission, that just by sweeping the floor, it was going to make a difference in getting a man to the moon. And I love that story because I think it really speaks to the stronger that a place has a clear mission, and that we as leaders have a clear mission on our floors and units in our organizations, the more likely we are to achieve our goals, and as evidenced by a guy walking on the moon. So who knows their facility's mission statement? I don't know. Melanie, do you? Whoops. Mary Ellen's looking hers up. How about anybody?
I'm looking.
I have it in front of me.
Everybody's like looking for like little Gotsies that they got when they started their work. How about anybody? And type yours in the chat if you know it. See, here's the dramatic first problem. We're connecting meaning and purpose and mission and vision, and by the same time, lots of people don't know it. Isn't that the truth? And so I know we're all into healthcare, so maybe it's that we have this big assumption that we're helping people, but organization, exceptional care without exception. Boston Medical Center. Thank you, Mary Kate. Beautiful. Advancing healthcare quality, empowering people. Oh yeah, that sounds familiar to me.
I cheated. I was able to Google it quickly. But then you see it and you say, oh yeah, that's right. So, I think one of the key things to mission statement, and I like the slide you had up, Margie, is the fact that it should be very simple so that, I'm helping get a man to the moon, Mr. President, but no one knows all the steps and all the different skill sets that allow that mission to happen.
Isn't that so true?
Yeah.
If you haven't done it, or if you don't want to wait, if you can't, you can establish one for your floor or unit and think about the what, think about the how, and think about the results. So I think, if you heard me speak before, I worked at the American Healthcare Association in Washington for 5 years, and they had the best mission statement. It was so good that we talked it to each other. If somebody came up with an idea and it was a solution that made a difference in improving quality, it got the big check mark. Sometimes there were the nice to-dos, but we were so focused on this exact thing. So it was improving lives by delivering solutions for quality care. And it was such a meaningful, and people talked about it. It was like, oh, what kind of solution can you come up with for me around this or that? So when you think about it, like, think about your floor or unit and think to yourself, like, what's my what? Maybe it's creating safety. Maybe it's creating home if it's a dementia unit. Creating home by delivering outstanding person-centered care that benefits Alzheimer residents with Alzheimer's disease. So just keep that in mind as we go through this, because I think you'll find that the simpler it is, the easier it is for people to remember, and the easier it is for people to know the direction that they're going. And so hopefully that'll make a huge difference. Another, a little more complicated, our vision, this is something we were working on at HealthCentric. Yeah, I agree. HealthCentric advisors, our vision is building community and networks of support that draw out the highest levels of quality throughout the healthcare system. And we believe in the inherent ability for improvement. We believe in innovation, person-centered care, building relationships, access inequality, and advocacy. And we live it by improving healthcare, by delivering solutions through networks, education, data, actionable resources, and innovation, while striving to be, by sharing stories of achievement, best practices, innovation, and then this last one, speaking to our distinct audiences. And so even though this might not fit like your nursing home exactly, think about what it is that what you believe in, and begin to create that in your organization, or begin to create that even if it's just on your floor or unit, and you can be that. You don't have to wait for the big declaration of the strategic plan for the future. Trust me on this. So just things to keep in mind. When you're in this process, part of it is when they talk about that line, that organization purpose and line of sight, what you're trying to do is create a connection. You're creating the connection between your residents and what your organization stands for, and all of those little steps all along the way. And so what would it take to get that to happen? And believe it or not, it's people talking about it, making sure that people know it, highlight the importance of the work in establishing the goals. And then look at this one. So leaders at all levels communicate the direct connection between the organization's booster goals, for instance, and everyone's work, how it's affecting declining infection rates. And each local leader can point to the work of staff and what they've contributed. So think about what you're trying to achieve and go share that. Talk to people. We got another couple of few good ideas. All of these things need to be really personal. And so sometimes it makes a huge difference when we share the residents' testimonials on how your mission and vision are impacting their lives. Sometimes that's families as well. And you know how much it's meant to people, especially during COVID, when staff were able to see, you know, how much families appreciated what was going on. We've been really encouraging folks more and more, those folks who have those big screen TVs out in the lobby, to put those out so people can see them. Make sure that staff know that they were specifically acknowledged, because like, it's so important for people to feel that connection, that their work is making a difference in people's life. You know, get deep and personal. And so, you know, get right down to the down and dirty of kind of like, wow, it was unbelievable how beautifully you helped them as their life ended. It was beautiful the way that you took care of them. That's the kind of thing that really gives a huge impact on people. And a lot of families often will write a letter a little while later, but be sure staff members know that it was their work that made a difference. Make it as authentic as you can. You need to believe what you're saying and doing, so that get out there and talk about it and make it perpetual. This isn't like a program or a particular service. And so let me just stop for a minute and check in with my crew. Anything?
Yeah. So I've worked in an organization that used to leave or have available cards for the residents to be able to thank staff, to actually say, thank you for doing this for me. It impacted me. And that the staff appreciated it so much. And that's just bringing it back to what you're doing every day and how it's actually impacting people. I also, during COVID, I think there's a lot of organizations that were innovative with the way they educated the staff on getting vaccinated and use the residents' testimonials as to why it's important to me for you to be vaccinated. And that really moved the vaccine in some of the facilities. So I thought that was a great example.
Beautiful, beautiful. No pressure, Mary Ellen. I see you're off mute.
So I'm thinking about it from a family perspective, because I have worked in acute care and learning the long-term care setting. I only know of it because of my dad had dementia, and he was in long-term care. And, you know, interestingly, one of the things that was most impactful to me, and he also passed from COVID. So that, you know, it was quite the journey for my family and I to experience long-term care. And then, you know, unfortunately, contracting COVID. And so one of the things when we talked about music earlier was he had such a connection to the staff. He was just a very social person, but he was very attached to the activities director. She was lovely. And in that time when we could not see him, and there was, you know, there was that void of no connection, I was doing Facebook Live concerts. So I was actually doing it probably helped me too, but I was doing it for my friends and family that were feeling very isolated. And so you can do a free concert on Facebook for, you know, an hour or so. Unbeknownst to me, the activities director knew about it, because before COVID, we did do the Facebook or FaceTime or whatever we did with Dad. So she knew I was doing the Facebook Live concerts, and she also knew that they stay on there perpetually, if you will. So she used to play those for my dad. And I did not know that. Probably a good thing I didn't know it. I don't know if I could have gotten through that concert, but just that act of her connecting us through music, because he loved music, will stay with me forever. And I think that's the big thing looking at people's missions, is that it's the day-to-day grind. And I know it's exhausting, but there are things that you do that you probably don't even realize that will stay with patients and families forever. And I think, that's what I'm thinking of as I'm listening to this. So
Yeah, well, I have to say that's activity director was like getting a man to the moon.
yeah,
Clearly,
yeah.
clearly
And the
what,
whole team is great, but that just stood out to
yeah,
me, because it was just so unexpected, and so appreciated. Till my dying day, I will appreciate what they did for him during this
yeah,
very terrible time.
yeah, yeah. Amazing, isn't it?
It is.
Yeah. So just a few other little things that we can talk about. Focus on who's being served by the work and put a human face behind every statistic. So, data is so powerful, but making it come to life by focusing on people. During the COVID pandemic, we still had, 97 activities going on a week to ensure that people didn't go without, interventions and socialization, or had somebody check in on them. Any of those kinds of things. Remind staff of the why and find new ways to reinforce it every day. So back to that, the three different things, the why and the how. Use staff meetings or huddles as a time when staff can talk about why the work is important to them and what makes for a good day. When we started this, we asked you to go and talk with folks about what makes for a good day and what matters most. And believe it or not, it was as good on week 1 as it is on week 11. So finding out what some of those things are and making the connection makes all the difference. It's not too late to go out and find out what matters most to people, and then bring that into the work. And engage families and residents in sharing their stories as much as possible, which we've mentioned, so I'm going to scoot by. Just so you know, we developed the Hatch model years and years ago, but it turned out the Veterans Administration took it and ran with it, and they literally made it the hallmark of all their work. And so they reinvented themselves. And this is the employee booklet that they give every single employee. And the employees have to sign that they agree before they'll even work in one of the CLCs. So just to show you what other organizations have done, these guys totally took it to the next level. So Hatch is a kind of neat thing. It breaks out into 6 different domains, and each of the domains, that's residents at the heart of it all. And what they've done is actually built it out so that the best possible care in each of the domains is kind of identified. One of the things that's important to remember in the midst of all this is like what Starbucks has done. They made it real by actually having a regular session where they actually had a place so that people could speak up anytime they felt like the organization wasn't living up to its mission. So unbelievable. I was on the board at Plaintree for a while, and Plaintree is an organization that's committed to person-centered care. And it became kind of common practice that in one of the Plaintree nursing homes, if people didn't like what was going on, they'd go, "That's not Plaintree." And it was like, whoa, damning statement is sizzled, because it was like, whoa, there was something that people knew so deep that you could trespass, and it wasn't good. And so people really had it deep, and these guys actually created a means by which to get people to respond and keep them on track. I also mentioned that it's the reason that they've been going, the voting about being unionized. And it was partly because people got to speak up and and created that kind of culture where people could. So I don't know if you see that as a good thing or a bad thing. I'm going to skip this one. So I'm all about all we have is now, and what might you try based on today's program? Can you see yourself making any adjustments, any small changes, big changes? And let me open it up to my colleagues also.
Sorry, I was typing in chat. I wanted to type in what might you try based on today's changes. You know, I was thinking about this too, just from a program perspective. I recently took a position as the nursing home lead for Ohio, New York, and New Jersey. And I thought, how could we write our own mission statement, and how could we make sure that we're driving our work every day to the mission that we have? And our mission is to support the nursing homes that we're working with. So I think I'm going to bring it back to my team and develop our own smaller mission statement.
Love what you're saying. Love what you're saying. Anybody else? Anybody else? Well, we hope
You're welcome to come off mute.
Yeah.
Anyone? Yeah.
Yeah. And then I'm just going to go over here because I'm supposed to let Melanie say.
Yes. Yes. So I know Mary Ellen is going to send us off. So, but I'm just going to say these couple things before we go. So 3:30 tomorrow is a repeat of today's. So if maybe you have some colleagues that didn't get to join, we will be offering this 3:30 tomorrow as well. IP3 this week is on enhanced barrier precautions, because that was requested. So that will be our focus. We also might try to talk a little bit about precautions in general in the nursing home, but we'll see how far we can get with the enhanced barrier precautions. So very excited about that conversation as well. That's Thursday at 11. And Mary Ellen, thank you.
You're welcome. I guess I'll end it. If you guys have to leave, feel free. But this is for all of you out there. We know how hard you're working, and hopefully this just gives you 60 seconds of joy today. Slow down, you're moving too fast. You got to make the morning last, just kicking down the cobblestones, looking for fun and feeling groovy. Hello lamppost, what you doing? I've come to watch your flowers growing. Ain't you got no rhymes for me? Well, do, feeling groovy. Well, la da 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 da, feeling groovy. I got no deeds to do, no promises to keep. I'm dappled and drowsy and ready to sleep. Let the morning time drop all its petals on me. Life, I love you, all is groovy. Well, la da 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 da, feeling groovy. La da 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 da, feeling groovy. Feel groovy, everybody. Thanks, you guys. Thank you for letting me channel my inner Joan Baez.
Have a good day.
Everybody have a good
Thank
day.
you.
Thanks.
Bye-bye.
Bye.
Thank you.